and welcome to Emergency Focus Resuscitation Workshop. So day one is going to be a concept building exercises. And day two is when we're going to do a lot of scenarios and where we're going to consolidate that 5-point strategy. Today, we're going to talk about how to have a systematic approach. Without further ado, we'll jump on and start with the ECG workshop. So the system that we're going to follow is rate, rhythm, PR, QRS complex, ST segment, and T waves. All right. Case one is ambulance calling in about a 65-year-old male with 30 minutes of history of sudden onset of central chest heaviness and shortness of breath. He's complaining of severe dizziness and he's had 2 syncopes. Clinical relevance is important while interpreting the ECG. This is a patient who's come in hemodynamically compromised with a low heart rate. So you're already expecting AV block, high grade AV block. Plus he's had chest pain. So you would be expecting some sort of ischemia pattern. So there we go. First of all, let's go through the rate. Let's just go through our system. So basically, yes, there's ST elevation in 2, 3 in AVF and also reciprocal. So Dr. Samantha, what reciprocal means is a mirror effect. Okay. Also, we've talked about lead 3 ST elevation compared to lead 2, meaning the right ventricular infarction. Whenever I ask you the management, please tell me the most definitive management first. This patient needs urgent cath lab and a pacemaker. Okay. So anion gap is sodium minus bicarbonate plus chloride.
Plus chloride, yeah.
Normal value is between 4 and 12. Okay. So there are 2 conditions. High anion gap metabolic acidosis and low anion gap metabolic acidosis. So high is this. All these conditions cause high metabolic acidosis. Moving on. So what does it all mean? Early detection of lactate, severe sepsis, bowel ischemia, mesenteric ischemia, like the patient who's in atrial fibrillation and has got severe abdominal pain. When you feel the belly is soft, but the pain is completely out of proportion of examination finding. That classic tip. High BSL and severe acidosis means TKA. All right. And now we're getting a new problem. We're getting patients with euglycemic decay, meaning the patient would have normal blood sugar, but they would be acidotic. So it has become a recommendation now in New South Wales and all the Australian hospital. Any patient who are on these new novel like drugs like gliptins and SGLT2 inhibitors for diabetes, they must have their pH checked. All right. The other thing is toxic alcohols. Like, the patients who home brew their beers or alcohol, they can got toxic alcohol, but they have high osmolar gap. A 40-year-old female known to suffer from an epilepsy is attending emergency with a 2-day history of diarrhea. She's feeling lethargic and weak. Tachycardic 120, blood pressure 107/69, respiratory rate of 24, temperature of 37.2. ECG shows sinus tachycardia, urine shows ketones, and this is the blood gas. Tell me what medication that you're worried about here.
Anti-epileptic.
May also most likely she could
Very
be
good.
Anti-epileptic. She could be some of the
Anti-epileptic medication can cause something which is in this list. What could that be?
Renal tubular.
Is it renal
tubular
acidosis?
acidosis.
Yeah.
25-year-old morbidly obese lady with a history of asthma comes to emergency with a severe shortness of breath and wheeze and chest tightness. She has been unwell with mild cough and rhinorrhea, but not treated with any antibiotics. She is complaining of excessive daytime somnolence, like sleepiness, and interrupted sleep overnight due to snoring for past 12 months. There's also a slight component of lactate being elevated, which might be a combination of factor that she's peripherally shut down, she's got early metabolic acidosis, and she will decompensate. Plus, she's also got PO2. Nobody's commenting on that. 45.
Yes, it's low.
Why is that?
Type 1 respiratory failure?
Yes. Yeah. So she's got type 1 and type 2 respiratory failure.
Type 2.
So what does that mean overall?
Respiratory failure.
Yes, so she's got respiratory failure and she's obese, morbidly obese lady with type 1 and type 2 respiratory failure. And she's got daytime somnolence. She has got what? What has she got?
CNS.
She's got a condition. What is that condition called?
Obstructive sleep apnea.
Very good. Obstructive sleep apnea. She's obese. She's got daytime somnolence. She's hypoxic. She's type 2 respiratory failure. She's got obstructive sleep apnea. So she needs what?
CPAP.
CPAP.
She needs CPAP or BiPAP. Okay. So this is a condition called obesity hypoventilation syndrome, which means that they are obese. They've got an atelectasis of the lung. Their lungs are not expanding because their tummy is so big. The gas exchange is poor. So carbon dioxide is always going to be high in their body. Because of this chronically raised PCO2, the bicarbonate is rising to compensate for that. And their oxygen is also low because lungs are not expanding. The gas exchange is not happening. Whenever you see a CT scan, I want you to follow the system. Soft tissue, bone, blood, brain, spaces, shift. Now I'm going to give you cases and I want you to go through each one of them. What is soft tissue? This is the soft tissue. Scalp. So that's start from outside, okay? Outside to inside, right? So when you see soft tissue, you'll have this soft tissue swelling, okay? Then bone. You can see a crack here. That's a skull fracture, all right? Then blood. This is all the blood.
Blood.
Okay. So this is white. The brain is gray. That means this is a fresh blood. When it's an old blood, it becomes more like a grayish black. Okay. So this is a fresh blood. Then we look at the brain. So when you comment on the brain, you comment on symmetry. Is left brain, which is this brain, right brain, which is this brain, is same as this brain, which is the left brain? No, they are not balanced. They're asymmetrical. All right, this brain is pushed. Then we look at the spaces, the ventricles. This ventricle is slit. You cannot even see the anterior horn of the ventricle here. What about the anterior line?
Obliterated.
Yes. It's an obliterated line, okay? At which level is that?
C3, between C3 and C4. Yes.
Right. Also, the spinal level. So whole two columns are disrupted. All right. So what's happening in here? I'll show you what's happening in here. This is what's happening in here.
Very helpful, Laura.
Yeah, that's got ECGs, that's got radiology, that's got resuscitation, ACLS and BLS. It's got everything. And I want you to read that 200-page manual before you come to see me in Liverpool Hospital, which is in 10 days' time.